All right, we'll get started. Well, good evening. Thank you all so much for being here. My name is Inam Sakina. I'm the co-founder and president of Future Doctors in Politics. It's truly a thrill to get to welcome all of you to what we expect to be an enlightening and inspiring conversation between trailblazing physician advocates on the role of doctors in driving patient-centric political change. This event, of course, marks the launch of Future Doctors in Politics, which we pioneered to empower future doctors to do just that, to use their voices and resources to make our country's politics and policies work for patients and communities. Fittingly, we're getting to commemorate the start of this journey to make change happen with all of you. I know the virtual setting makes it difficult for all of us to see this, but I can tell you that we have an extraordinarily diverse group of people gathered here today, from students at medical and dental schools across the country, to practicing and retired physicians and nurses, to the supportive families of our future doctors, among many, many others. All of us come from a variety of backgrounds. We're at varying points in our training, and we likely have different interests inside and outside of medicine. But I imagine what brings us together in this moment is that we see our systems failing the people they're supposed to serve. And we can't stand by as people keep dying or suffering because our elected leaders can't be bothered to intervene. It's that realization and that resolve that were the seeds for what in just a few short months has become Future Doctors in Politics, a national nonprofit powered by medical students and physician leaders nationwide, poised to drive political and structural change that centers patients and communities. So before we transition to our conversation where we'll talk more about what patient-centric politics actually means, I wanted to take a few moments to share with all of you how we started, where we are now, and where we're headed on this path to make patient-centric political change a reality. So a little over 6 months ago, our founding team of mostly first-year medical students were donning our white coats for the first time, and we were taking that sacred oath to serve our patients, just like every physician in every generation before ours did. But here's the thing, we were putting on those white coats virtually through a Zoom screen in the middle of a pandemic where thousands and thousands of Americans were needlessly dying because our political leaders were failing, where our fellow health workers were having to risk their lives to save lives, where crushing inequity of our patients, our future patients, were being intensified, and our patients of color were being made to suffer more than anyone else. At that point, I think it was clear to us that the biggest problems our future patients will face are systemic and structural, and they're not going to be solved by our writing another prescription. When our future patients are having to choose between putting food on the table and buying medication, or between keeping a roof over their heads and having insurance, those are symptoms of a deeper problem that we can't treat with another pill. So, honor our oath to serve our patients, what we realized is we have to tackle what really threatens their health the most, which is the chronic and continued political and policy neglect by their elected leaders. So ultimately, to save lives and improve health, we have to pass laws and legislation that transform our failing systems. And to pass those kinds of laws, we have to elect the kind of lawmakers that are going to put patients, science, and equity above profit and political expedience. So once we arrived at that conclusion, the question was how? What does this even look like? How do we elect those patient-centric, science-driven, equity-minded policymakers? How do we make sure the kinds of laws that are being passed actually serve patients and solve problems? And so after reflection and conversation, our answer really was that the way we do this is by equipping ourselves and our peers with the motivation, the education, the skills, and the hands-on experiences we need to drive policy and political action that ultimately centers patients and communities. And so that's where our organization was born, Future Doctors in Politics. We decided to start this organization to do 3 things: change minds, build skills, and position students for impact. In med school, we spend a lot of time learning about which pills to prescribe for our patients, but not a lot of time thinking about the bills and the laws that impact their health the most. And so, what we're doing is launching chapters at medical schools across the country to change minds, first and foremost, by making the case for political advocacy being a professional responsibility. We're meeting our peers where they are, and we're engaging them through social media campaigns, through a new podcast we're about to launch called Our Exchange, and through quality virtual programming that's going to build policy and political literacy for med students across the country. We're building skills by training students to use their voices and experiences to drive policy change, whether that involves writing op-eds, providing expert testimony, lobbying legislators, getting candidates elected, or one day running for office themselves. And last but not least, we're positioning students for impact by building the infrastructure to ultimately deploy medical students to meet voters where they are, to meet voters where they live, so they can learn about their priorities, learn about what matters to them, and ultimately turn out their vote for patient and community-centric candidates running for office. So as we start to bring this admittedly ambitious vision to life, we can't envision a better introduction for it than learning from the journeys of physician advocates who have already embodied the power of practicing medicine as physicians while simultaneously seeking to drive structural change as policymakers. They both are forerunners of a model of public service that we hope our organization can inspire and empower generations of future doctors like us to pursue. One thing I do want to mention before we transition to the conversation is, as you all know, Senator Saud Anwar was supposed to be with us today. Senator Saud Anwar represents a district in Connecticut and is a physician, policymaker, trailblazer that we were looking forward to hearing from. Unfortunately, he could not be with us today. I actually received an urgent call from him this morning that his brother in London was on a ventilator with COVID and that his situation was deteriorating and he needed to be with him. And this afternoon, we just learned that his brother passed. And so I wanted to just extend our thoughts on behalf of the organization and everyone here to him and his family. And just share that with all of you. So without further ado, I do want to invite one of our co-founders and the current president of our founding chapter at Harvard Medical School, Marianne Zhao, to introduce our speakers for this evening.
Thank you, Anam, for that introduction. And thank you to everyone in our audience for attending tonight. We're so excited that you've all decided to come here. As a first-year student at med school right now, I felt so lucky just be connected with peers and other students like you who are super eager to explore what political engagement can look like as a physician. And so today I'm going to be introducing our speaker, and it's an absolute pleasure to be having them here today. So first, we have our moderator, Dr. Robbie Goldstein, who is a member of the Future Doctors in Politics National Board and a former congressional candidate of the Massachusetts 8th District. Dr. Goldstein is an infectious disease physician and primary care provider at Mass General Hospital with a particular focus on caring for LGBTQ community and those living with HIV and those at risk for HIV. He serves as the medical director of the Transgender Health Program at MGH and co-leads the hospital-wide initiative to improve care for transgender and non-binary communities. And in addition, he's also an instructor in medicine at Harvard Medical School and is an assistant in medicine at MGH. Welcome, Dr. Goldstein, and thank you for being with us today. Dr. Goldstein will be joined by Senator Michelle Au in a conversation on what it means to be a physician senator. Senator Au, again, congratulations on your recent election to the seat in the Georgia State Senate representing District 48, and she's also the first Asian American legislator in Georgia. Senator Au is a first-generation Chinese American who grew up in New York City and trained at Columbia in pediatrics and anesthesiology. She moved to Georgia in 2008 with her family, where she is an equity partner at Physician Specialists in anesthesia at Emory St. Joseph's Hospital. And she has previously mentioned as well that her interest in improving health community health on a larger scale motivated her to return to Columbia for an MPH, where she studied healthcare policy, economics, and law, a degree that has really prepared her for her role now as a state senator. So Senator Al, thank you so much for joining us. So just a quick logistical thing before we get started. If anyone has any questions throughout the session and the conversation, we just ask that you chat it to the panelists in the chat function, and then we will be collecting them and fielding them for the Q&A session at the end. So without further ado, Dr. Goldstein, I'll pass it on to you to start the discussion.
Thank you very much. That was an amazing introduction for an amazing organization that I am really honored to be a part of, and so happy that I can be here tonight to have this conversation. Thank you, Senator Rao, for joining me in this conversation. I really hope we can make it conversational. Let's just go back and forth a little bit and see where we end up. I know we have about 40 minutes, and then hopefully we'll get some questions from the audience as well. I thought I'll say one of the most common questions I got asked when I told folks I was going to run for office, and as I was running for office, was why? Why give up being a doctor? And that was actually their term, not mine. Why give up being a doctor to go into a completely different profession? And so I'm going to reflect it back to you and say, why? Why go from medicine into politics?
Dr. Goldstein, such a great question. And that's the most common question I get asked too, especially at the hospital with my colleagues, you know, when we're just like in the anesthesia lounge, just like chilling, eating lunch, people are just like, no, but really, why would you do this? You know, because it's almost unfathomable to a lot of people in medicine why you would take yourself away from a profession that is so rewarding and has so much social good to do something that a lot of people view as kind of nuts. So I'm going to ask you that question after I answer, because I want to hear your answer too. But just to set up this conversation, because I would also like it to be very conversational and loose. And I'm going to set it up by showing you this. We all have our nice Zoom backgrounds now, right? Because we've been doing Zoom for a year now. So we all have our, you know, like lights, and we know how to dress up on top, right? This is the same clothes I was wearing to work today when we were in the Senate chamber, but I'm just going to show everyone so you get this dichotomy of our lives and how we divide our time now. That down below, I am wearing my scrub pants, because you got to wear your comfy pants. And this is how I feel the most comfortable, is wearing my doctor clothes. And it honestly feels very weird to go into work wearing, you know, a blazer, because it's not what we're used to. So I think you're right in wondering why someone would take themselves away from a profession that is, like I was saying, so rewarding. And it's something that most of us, you know, to be a doctor, you really have to invest a lot of time and a lot of energy. And it's something you've been thinking about likely for many, many years, if not decades, to do the work we do, which is to help patients, right? Why would you walk away from that, especially at a point in your life? You know, med school is rough. Residency is rough. You get to be an attending. The first, you know, I'd say a couple of years of being an attending is also rough. But when you hit your stride and you're really in the swing of things and you feel mastery over the work you're doing, why would you take yourself away from that, right? I ask myself that too. And my spouse asks me that. All my colleagues ask me that. Here's the answer. Here's my answer. Let's just say that. About, you know, once you get invested in your practice, but even honestly, well before that, even in med school, you start to get a sense that many of the things we try to do for our patients, many of the interventions we try to do, many of the ways we try to make them healthier, hit at a point that's really too late to help a lot of people, right? And a lot of the things that make our patients sick and make our communities unhealthy happen well before they get to us, right? And I'm an anesthesiologist, so I feel that especially, that by the time they get to me, that they are, you know, half an hour before having surgery, that it's really too late to fix what made them sick in the first place. After, I'm not going to be too partisan about this, but I'll just say the date. After November 9th, 2016, you know, you wake up that morning and you, I was about a little less than a decade into my post-residency career at this point. I saw what was going on. I was disappointed that morning, and I realized that whatever I was doing in my life, no matter how rewarding my professional life was, it clearly wasn't enough, right? And that there were a lot of things I was concerned about in our communities, and I was concerned about our patients, that I wanted to do more to invest in community-based health and population-based health that I wasn't able to do just as an anesthesiologist at the bedside. So what I decided to do at that point was to go back to school and get my master's in public health, just like you, Dr. Goldstein. I know you have an MPH too, so I'm sure you had a lot of that similar drive to help on a larger scale. When you get an MPH, as you know, you do learn a lot about larger issues in medicine that you don't get to learn in medical school, right? You learn about healthcare policy, you learn about healthcare law, you learn about healthcare economics, which I had never taken an economics class before, right? Because I was like a good little pre-med. I did all my science classes. It's really eye-opening to learn about the system that underlies the superstructure in which you've been working for more than a decade, and realize, have that insight into why things work the way they do, and more importantly, why things don't work sometimes for our patients and for the patients, people trying to take care of them. When you get that insight, and I'll skip a couple of steps, what you realize is that in order to affect the kind of change you want to see for your patients, you actually do have to get involved sort of further upstream from the bedside, and that the way that change happens is often at the legislative level and at the policy level. And that I don't know if I'm going to say the best way to get involved in it, but maybe one of the more active ways to get involved in it is to be one of the people informing policy and informing the lawmaking process, and having someone at the table where these laws get made, where the bills get passed, that actually knows something about healthcare and knows something on the ground about patient care, and can help guide where those decisions get made, right? I think there's an underrepresentation of people with medical backgrounds and public health backgrounds in the legislature. I think we see that more than ever with COVID. You know, COVID has exposed a lot of things about what works and what doesn't in our legislative system. And in the end, it's just like any physician, you want to do what is of the most use to your patients. So that's the long/medium answer to why I decided to run. But I'd love to hear your story.
No, I have to say my story is almost the same in many ways, although obviously the circumstances are different. But one of the things I made very clear when I was campaigning, and I think you share this as well, which is that I'm not giving up being a doctor. You never give up being a doctor. I will always be a physician, and that is actually what informs policy decisions and the way that I think through problems. My why comes from being a doctor, from seeing patients and recognizing, just like you did, that so many things were impacting lives before they walked in my clinic door. As a primary care doc, I was seeing people pretty early on, pretty upstream, at least in the medical process. But even for me, I was seeing them too late. They already were dealing with structural racism, with an education system that wasn't working for them, with a housing system that wasn't working for them, with a transportation system that wasn't working for them. And it was very easy for me to recognize that all of those things, education, transportation, housing, that's all healthcare. It actually is all the same. It's all healthcare. We'll see if Anam and Marianne get mad at me for doing this, but I don't want to make this too partisan, but I do kind of want to reflect something that you said, which is you took your MPH classes, you saw this new world that we don't always see in medical school sometimes, that showed what some would argue are the reasons for progressive policies. But when we look historically, a lot of physicians in politics happen to be conservative or Republicans. And I'm wondering if do you see a trend? Do you think that we're going to see more progressive or more liberal Democratic physicians running for office and exerting their influence? Is COVID changing that for us? What's your outlook on everything?
I would love to see more progressive physicians running. I'm going to say, here's my observation of having lived in the medical world for, like a couple of decades now. And what I'm starting to see at this inflection point that I think we're at. I think, I work in a surgical subspecialty field, so I work with a lot of surgeons and people who are skewed in one side of medicine. That many doctors, at least where I work, and I live in Georgia, right? So take that into account too, that I live in the American South. Many older doctors especially, and doctors who tend towards the surgical subspecialties, do tend to be a little bit more conservative in their views, especially older doctors. However, what I'm starting to find now that I've been working with a growing influx of younger doctors who are coming fresh out of academia, and doctors who are affiliated with an academic medical center that draws people from different parts of the country, is that I am starting to see more progressive stances and policies when it comes to not just medical issues, but political issues. And people are more willing to talk about politics and how it affects our patients in the workplace. You know, I started as an attending in 2008, so about 12-ish, almost 13 years ago. Ooh. Getting old, guys, getting old. And at that time, it was sort of verboten to talk about politics at work because it was felt to be separate from our professional lives, right? It's like talking about religion or talking about money. It's like that's not polite talk in the hospital. That's it's not for us. It's not medical talk. And I think what we're seeing now with this influx of more progressive thinking, younger doctors, more progressive doctors, is that we realize how much these social determinants of care, just to go back to public health lingo, affect the immediate medical issues that we deal with at the bedside, right? And, you know, when people see that I'm a doctor in the legislature, they often think sort of in concrete ways, like, oh, you're a doctor, help me with this like drug pricing bill, or with this like insurance bill, because they think very like close up to immediate patient care issues. The good thing about having a public health degree or a public health background, or even a public health interest, is that you actually realize that there's nothing that is involved in public health that doesn't become a legislative issue, right? Because all these social determinants of health that you, Dr. Goldstein, had mentioned affect the health of our communities. And they're not the classic medical things that we think about. They are things like economic opportunity, housing, transportation, education, public safety. All these things, I would argue, affect our community's health far more than anything that I can do or you can do in the clinic, at the bedside, far more than any medication I could give, far more than any therapy I could provide. These are the things that matter, right? So I think there's been a generational change even in the time that I've been an attending, and I'm seeing it more and more. So I don't know, I would love to hear actually from our medical students here, if there's been a change in the curriculum or how people are approaching medicine or what's bringing people into medicine, but it's definitely noticeable, and it makes a huge difference in the kind of care that we provide our patients.
I completely agree. I think we're seeing a huge shift. Something that a good mentor of mine in the hospital where I work said to me early on when I approached her and said, I'm running for office, I want to jump into politics, and it feels like we just can't have these conversations in the walls of the hospital. And she said, we really have to change that. And she mentioned to me, she said, you know, we shouldn't be partisan. It is not appropriate for the hospital to be overtly partisan, but it is okay for us to be political, because political decisions impact our patients every single day. And if we don't get involved, then our patients are going to suffer. And I think I tried to carry that with me in every conversation I had with a colleague in the hospital, who oftentimes would say, we shouldn't do this inside the hospital. And I'd say, you know what, we have to do this because we have to talk about these issues. I want to sort of give you an opportunity. I'm going to feel it maybe like your campaign manager at some point, to share with us some ways that patients have actually been a part of your policy making. I remember being told many times, you have to tell patient stories. You have to tell patient stories. But how do those stories play out for you on your day-to-day in the State House as opposed to in the hospital?
Great question. I want to jump off one thing that you said, because I think it's the key point that we need to make when it comes to healthcare policy and people talking about politicizing medicine, right? Because I've certainly been accused of this, during the campaign, my opponent certainly accused me of politicizing medicine or politicizing COVID or whatever people say. Here's the thing that we need to realize is that when we talk about science, right? Science is inherently apolitical. And I think that's a good thing, that we should be able to process science on its own merits. However, public health is inherently political, right? Because the lever arm of public health is policy. That's how public health works. So we really do have to take an active role when we want to engage in public health in the legislative process, because that's how public health measures get carried out. So I really commend you for running for office and realizing this, probably far earlier than I did, that this was an important piece to the puzzle, and that we can't fully serve our patients without becoming politically involved.
Yeah.
So in terms of patient stories, there's obviously like so many stories that one can think of over the course of, even a, mid-aged or, career. But one that I think of, and there's many iterations of this type of story, comes down to an issue of healthcare access and the harms you see when people are unable to access healthcare. So, as an anesthesiologist, when you're on call at night, often that is when your biggest train wrecks come in. And I don't say train wrecks as a pejorative. I say it in terms of having everything going wrong at once. So, I have had, more than once, but I'll just pick one, patients coming in, life flighted in, with the helicopter, and everyone knows they're coming and everyone's like waiting at the helipad with a aortic dissection, which, as we know, is one of the most critical sort of surgical cases that we can get. It was a younger patient. She came in from rural Georgia, where there is not very good healthcare coverage. As we know, we're in a rural healthcare crisis, both nationally, but especially in Georgia, where we've had a lot of rural hospital closures because we have, Georgia's one of the 12 states that have so far still refused to fully expand Medicaid under the provisions of the ACA. So that is great for our patients to have less access to care, even though the money is due to them to come back and take care of them. Anyway, so this patient came in, she was young, she had a family, she had kids, they were about the same age as mine. And so far as we could tell, the reason that she had this dissection was because she had untreated hypertension. Hypertension is an incredibly common ailment, as we well know, and as Dr. Goldstein obviously probably treats every day with his patients.
Okay.
Easy to treat, right? I have hypertension, right? I take losartan. I assume it's okay, she said. But because this patient didn't have access to insurance and didn't have access to a primary care doctor and didn't have access to medications, had uncontrolled hypertension, dissected aorta, and ended up being in the OR all night, all day, with really catastrophic results, right? So you spend your time in the OR really thrashing it out with this patient. The whole team is just like going all out for her, because it's something when you see a patient who is the age, who is your age, who has a young family, and you feel like this shouldn't be happening. Like this, how can this be happening? So you almost, we should treat all patients the same, but sometimes there's some patients that we all associate with a little bit more for whatever reason it is. And this patient had a catastrophic outcome, and it didn't have to happen. And you think about how little it would have required to avoid this, right? And it's always easy to be the Monday morning quarterback and be like, if only she got her metoprolol, this wouldn't have happened. Like, who knows? Like, I'm not saying there's an absolute fix. There's no silver bullet to any one problem, but it couldn't have hurt for her to have been addressed and treated earlier, right? And that's just one patient. There are many, many, many patients exactly like this. And it's hard to be the last line of defense when you know there were 10 checkpoints up ahead that we could have helped with, that could have avoided all of this, even just in terms of allocation of healthcare resources that we talk about a lot. None of this had to happen. So how do we fix that? Do we just complain about it and say, wow, I had such a bad night on call, let me tell you about this story? Or at some point, do we decide, I have time, I have insight, and I have experience to speak about this intelligently, and maybe it's time for us to jump in the game?
What's so powerful about that story is that it highlights not just one reason why physicians need to be in politics, but a dozen reasons why physicians need to be in politics. It's a Swiss cheese model of what's going wrong with policy right now. And it's about Medicaid expansion. It is about making sure we build up rural hospitals and rural health systems. It's about building trust with our patients and making sure people feel comfortable coming into the medical system. It's about making it easy for them to get there. So they have a subway or a car or a sidewalk that can actually get them to the hospital. It is all of those things. And it's what we see every day. And we're oftentimes focused on the end result because that's what's in front of us when we're in the hospital. But we have to think about what goes into it. It's a really powerful picture, and hopefully the young physicians to be on the call can recognize that as they're going through their training. One question I'm going to pose to you, which is something that came up a lot for me on the campaign trail. And it was that a lot of people looked at me and they said, what business do you have running for politics? You haven't had the right training for it. Almost insinuating to me that if you go to law school, at the end of law school, you can just snap your fingers and be a fantastic politician. But if you go to medical school, one must do some other type of training in order to get them there. And I used to, maybe I'll share after you answer, I had a really sort of snippy response back to folks about that, that I think medical school is a great training for politics. But thinking back on your medical school time, sort of beyond the MPH stuff, but the med school time, what are the lessons you learned there that you think are really helpful in running for politics?
You know, that's such a good point that you make about who should run for politics and who has the right experience and who doesn't. Because I don't know that I've been told that explicitly, maybe a little bit like sort of like secondarily, but I've certainly even felt like that, you know, like even when I was running and as a first year legislature, I think there are a lot of lawyers there, you're right, you know, and they have experience that makes them more comfortable in certain areas and it makes them more fluent in the language of lawmaking, that it makes me feel sometimes a little bit like I'm not as prepared as some of my colleagues are. However, what I will say also is I always make an analogy to the hospital, right? Is that when you're in a hospital, you have people who have all different types of specialties. And how well would your hospital run if every single doctor who was there was a neurologist or every doctor was a cardiologist? Would you be covering all your bases? Would you be seeing every problem? Would you be able to fix the problems that you see? Probably not, right? It takes a village, as they say. And I think the special skill set that doctors bring, and this is doctors across all fields, are two that I can identify sort of immediately, but I'd love to hear your thoughts on this also, is the first thing is that doctors are trained almost unknowingly, because it's not even explicit so much as it's just part of our DNA after a certain point, to quickly identify problems and distill them down to sort of like the action items we need to address, and to work well and communicate well as a team in order to address these problems efficiently and accurately, right? So that is a skill set that I don't necessarily see as much in all comers. Let's just say it that way. The second skill set that physicians have, and I think this is pretty much all physicians, is that we have the ability to very quickly connect with people in a very intimate way that not necessarily every profession gets the honor of that type of access, right? And I'll just reflect back to my own field, just because that's the one I know the best, is that I'm an anesthesiologist. So often I'm meeting patients like literally like 20 minutes before they're having major life-changing surgery. And in that very short amount of time, I have to get them to know who I am, feel comfortable with me, to tell me very important and intimate details about their life, and get us to have this working relationship where I can adequately address their problems and address their concerns, allay their fears, and help them get through it. I think that for a politician, it's not something that I thought before I ran for office that this would be a skill set that was useful. I thought of it as a purely medical skill. But in speaking with constituents and speaking with, really everyone, this is a very helpful skill set to have. And it's one that I didn't even feel like I had to work to develop. It's just part of being a doctor is doing that, right?
Yeah. And
that's incredibly valuable. And it makes a difference in how you relate to people. And that's really the most important part of being, I hate to say a politician because that makes it sound like it's just glad handing, of being a representative is that relational aspect.
Yeah, it's I'm glad that you pulled out those two pieces, because those are the same pieces that I would always answer that question with and go back to. For the medical students who are on this call, certainly the first and second year medical students, one thing that I always went back to is that in first year of medical school, I learned how to think. You learn in this SOAP note manner, subjective, objective, assessment, and plan. And that way of thinking, of pulling together subjective history that you get from an individual, marrying it with the objective data that really drive a lot of decisions, and then coming up with a very reasoned assessment so that you can bullet point out that plan and efficiently get through the problem. That is medical school from day one until the last day, until graduation. And I think that if we had more of that type of thinking in politics, we might see some much better policy that's coming out of state houses and out of the federal government. The other piece that you brought up too is that connection that you're trained from that first moment you step foot in the exam room with somebody. As a first year medical student, you're taught to walk into a room and introduce yourself and begin a conversation. It's about just talking to folks. A short anecdote I'll share was when I first decided that I was gonna announce my campaign, and I had a political consultant who was helping me think through some things, and she said to me, "Are you really sure that you can go around this district, meet with people, have them ask you any question that they might have on their mind and always have an answer?" And I turned to her and I said, "Do you know what it's like to be a primary care doctor? That is being a primary care doctor. That is my life every day. And I'm very comfortable in that space." And I think it does make the politicking part of politics feel a little bit easier, maybe in some ways, to have that skill. I'm gonna ask one more question, and then I think there's a bunch of questions that are coming in from the group that's out there. But we have a bunch of young folks who are on the call, a bunch of people who are just starting out in their medical career. I hope a lot of them run for office themselves and put themselves out there. But what else can they be doing? What are the other ways and paths forward for them to get involved, to make a difference, to impact policy in all the great ways that you're doing in Georgia?
Well, the first thing I'll say is don't put too much pressure on yourself, because I did not know I was going to do this until, when did I decide to run for office? It was probably less than 2 years ago, right? And sometimes it's not always obvious what you will be doing next, right? I think that when you are a medical student and when you're a medical trainee, you're accustomed to your life path being very linear, right? Because once you lock yourself into that path, like even in college, right? Like I'm pre-med, so I have to take these classes, and then I apply to med school here, and then I get in med school, and then it's year 1, 2, 3, 4, and then I apply to residency, and it's very linear and sort of prescribed what you should be doing. Life is not really like that, right? And life shouldn't be like that. And I often tell people who are pre-med or med students, don't feel like you should know what you want to be when you grow up, right? And I know everything about med school and everything about medical training tells you the opposite, is that you should know exactly the arc of your life, and you should know 20 years before exactly where you want to end up. That's not the case, right? I think and I'll just share this to show like how I've like screwed this up like a bunch of times, not to say screwed it up, but the non-linearity of life is that, one of the most classic things in terms of how you chart your life path is you choose what residency you want to go into. I switched residencies. I was wrong. Like I didn't know what I wanted to do. I chose what I thought I wanted to do, which was pediatrics. I did that for a little bit, and I was like, I think I might want to do something else. And I switched to anesthesia. I'm not saying this about anesthesia or peds in specific, but just give yourself that leeway to find your way and know that our paths, even in medicine, are not quite as rigid as we see them to be. In terms of being involved at a legislative level, or in terms of patient advocacy, or any of these things that we're talking about, what I would just say is this: leave yourself a little bit of a buffer in terms of your time. Leave yourself a little bit of buffer in your energy, because there's always more to life than just what's right in front of you. And it's difficult, right? Because medical school and residency and all these things take up an incredible amount of time, much more than other professions do, right? We understand this. When you have a rule in your profession that you can only work 80 hours, and that's like, or else you'll get in trouble if you work more than 80 hours, but everyone lies, it's like, this is a very specific type of life that we've chosen. It's a very specific type of profession where the assumption is that you're going to give everything of yourself and there's going to be nothing left over, right? We don't say it explicitly, but we can talk about this more, but that's the presumption. Leave yourself a little buffer, right? Because there's more to life than just what's right in front of you, and that's going to change over time. you can't do everything at once. And I don't think, honestly, that I would be doing any of this if I were younger, if I were still in training, if my kids were younger, right? I didn't start doing stuff until my youngest kid, I have 3 kids, started kindergarten. And that's one of those things where you realize like, oh, I have a little more of a buffer now. I can take on more, right? So just leave yourself open and just do what you're passionate about and let those opportunities come in. It doesn't have to be a specific type of activity. It doesn't have to be a specific type of pursuit. Like, I'm going to volunteer for a campaign. You can do that. I think that's really great. But just let the opportunities come in, because things will present themselves to you in a way that you might not have expected or been able to plan at all, right? But if your passion is patient advocacy and your passion is improving healthcare access, working on racial equity, just leave some time for that and let the other possibilities come in after.
It's amazing advice. I'm trying to live by that advice every day, trying to create that buffer. I'm a few years, many years now outside of residency, but still the idea of 80 hours, the work week is 80 hours. That's what we're told. That's what we're trained. So it's hard to transition. I want to thank you for letting me ask my questions and have this conversation. And I think that Anam and Mary are going to ask some questions that have come in from folks who are on the call. And I'm going to maybe turn it over to them to let them choose the questions that we're going to go forward with.
Thank you both so much. And yeah, so we've had a lot of questions come in, and guys, thank you everyone so much for sending those. So we've kind of selected a few. Unfortunately, I don't think we're gonna be able to get to all of them. We're gonna try to do as many as we can. So the first one's actually, I think, a really great segue into the last conversation that you guys just had, just thinking about, you're totally right. You do have this like limited capacity and limited time, and thinking, is it really reasonable? One question we got is it really reasonable to kind of expect balancing, be able to do clinical care and do your job as a physician while also holding an elected office? Or is maybe the better approach to think about it, your career in phases, thinking about like, do you want to first start with working, committing your early career to working with patient care, and then later in your career, dedicated policy? So I'm just really interested to hear how you guys kind of thought about this in your own careers. And I know you guys have already shared a little bit of how you even came to this position that you guys are in now.
I'm a big proponent in thinking of life in seasons, and not to be like all like old about it, like in this season of my life, but it is true, right? Because when you are a medical student, your time allocation is very different. And when you're a resident, it's very different from when you're an attending and you're trying to like raise a family. Like the way you split your time is very different, and it's very individualized. So I wouldn't, like, again, I would not encourage people to think about doing it all at once. You don't have to do everything you want to do in your life at the same time, right? And in fact, I would recommend against that, because you're not going to enjoy it as much, and you're not going to be able to bring as much of yourself as you want into each pursuit if you try to cram it all into the same place, right? I can't give anyone advice about when is the right time for them, but like I said, like you'll start to feel, or at least what I felt, and I'd be excited to see how Dr. Goldstein's experience was about this, is that I got to a point where I felt, okay, like when I was an attending, let's say, I'd been doing it for, almost a decade. So it takes a long time to get used to things, right? So don't think it's going to be like, I've been attending for 2 years. Now I'm going to like do this next thing. You feel comfortable with it. You feel like you've gained some mastery over it, and you think, you know what? I think I can take on another thing. It's like when you're carrying a heavy load and you're like, oh, it's so heavy. And you're like, I think I got this. Give me another one, right? Because I think that the thing about physicians and medical professionals in general is that we want to be of use. And it's like when you're in your medical rotations, you're in your residency, that you're taking care of patients, and you see it's very busy, and you're like, you know what? I think I could take on another one. Why don't you give me one of your patients and I'll take care of them? It's like that need to be of use, and to need to pitch in, right? And to not be doing too little. When you feel that feeling, that's when it's right for you to pick on something else. But you don't need to feel like you need to do it when you're overwhelmed, right? Because there's many points in your medical training you are going to feel overwhelmed, and you just be like, you know what? I'm good right now. Let me get a handle on this first, and when I'm ready to take on another thing, I'll let you know. Dr. Goldstein, what do you think?
Yeah, I completely agree with that. I also, not to get too philosophical, but I think we have to think about, how do we define being a physician? I'm not sure that to define being a physician, it means you have to be in the exam room or in the OR 5 days a week. I think that we define being a physician as being patient-centric, as thinking about healthcare as trying to improve the lives of people, that's being a physician. And I would never give that up. It doesn't matter if I'm seeing patients or not, I'm never going to give up that mentality. I happen to really love seeing patients. I think it's a really powerful moment to be in the exam room with people. And I had intended, had I won my election, to continue in some fashion to see patients because I think it is really important for me. And I want to just point out that no one said to Senator Elizabeth Warren, you have to stop being an economist when you go to the Senate. Right. And no one says to, a lawyer when they make it they're the governor of a state, like, you've got to stop being a lawyer and stop thinking about the law. So no one should ever say to us, you've got to stop being a physician, stop being a doctor, because now you have to be a politician. So it's a little bit of a philosophical question, I guess.
Thank you both for that. So this one is on a different topic that I don't know we've had a chance to touch on yet. It's on polarization. So we know that our society is deeply polarized, and polarization is only intensifying by the day. So what lessons have you learned in trying to bridge the political divide among constituents, but then also for Senator Zhao among your colleagues? Are there times where you felt like you've had to sacrifice your ideals in the name of progress and moving forward?
Well, here's the thing that I found, and I have the benefit. No, I'll say it's a benefit. I won't even do the finger quotes. I'm just going to say the benefit of, in my regular life, in my professional life at the hospital, of working with a lot of people that I don't always agree with politically, right? I work with a lot of Republicans. So I'm very accustomed to sort of negotiating that divide. And I think that especially in sort of high pressure situations, especially in the hospital, what we are accustomed to doing is, when we work as a team, that we are trying to find the most good, right? We're trying to get to an endpoint that achieves the most good for our patients. And it doesn't mean that we're going to get every single point that we want. I'm not going to be able to execute my anesthesia plan exactly the way that I envisioned it, because other people exist too, and other people have ideas too. However, what it comes down to when we have a goal, which is patient care, is that we share the same goal, which is to get this patient through this as best as possible. And once we realize that even when we disagree, what we're able to do is be diplomatic and negotiate a solution that achieves the most good. And how we approach that is, that comes down to difference in personality sometimes. And I'm sure that those of you who have rotated through or worked in the OR can see that there are many different personalities, and some work better than others. But I find that, especially in anesthesia, that diplomacy and negotiating these different push-pulls and reminding people that our goals are the same is the way to bridge these differences, right? And I think it should be that way in politics too, and that's how I've approached it so far. Again, I'm a first-year legislator, so I am still learning. But picking the goal, a shared goal first, and finding ways to reach it from two different sides of the aisle is, I think, the more successful approach, as opposed to assuming that these gaps are not able to be bridged.
I'm not sure I could say that any better. I think that was beautifully stated of comparison of what we do in the hospital to what needs to happen in politics. The only thing I'll add is that I think healthcare is in some ways the most polarizing part of politics. And especially if you think about it broadly and you think about reproductive justice and women's health, it is an incredibly polarizing part of policy. And that's not a bad thing. It doesn't mean we should shy away from it. It just means that we have to recognize people have really strong beliefs. But if we come to it at all coming for the same goal, all trying to say we're going to improve people's lives, it's much easier to find common ground. People oftentimes think of Massachusetts as this sort of bastion of liberal policy and progressives. And the district that I ran in actually was quite conservative. Many of the towns voted for Donald Trump in 2016, and some voted for Donald Trump in 2020 here in Massachusetts. And I went out there and I talked to those folks about single payer healthcare, and I talked to them about reproductive justice, and I talked to them about issues that were potentially quite divisive. But when we talk about it with a shared goal of how do we make sure people have healthcare access? How do we make sure that people are healthy? How do we make sure that women can live a healthy life during and after pregnancy. When you talk about goals that all people want, you can usually get to a compromise or some negotiated diplomatic answer where everyone has actually moved forward in the right direction.
Thank you for that. And so we're gonna move to our last question. Unfortunately, that's all I think we're gonna have time for, but I think this one's a really great one and really appropriate, I think, for the broad audience that we have here. So there's a question specifically thinking about, there are a lot of ways you can kind of make a political impact outside of running for office like you guys have. And there's such as like, you can think about advising on campaigns, working on campaigns, other appointed positions. And I was wondering, there's somebody who was wondering, did you ever explore these other avenues? And I guess what advice would you give to medical students now or any other trainees trying to figure out where exactly they want to fit in and like what paths they want to take?
I think a really, not to say easy, but the most ready sort of prefab way to plug yourself into healthcare advocacy is to start getting involved with your state or national medical societies, because most of them have a very muscular or well-developed advocacy arm that you can get involved as little or as much as you want, right? And that's the important part when you're a trainee, because I think a lot of people tend to not get involved because they're like, I don't want to like bite off more than I can chew, because what if I like do this and then I don't have time and then have to drop out, and people don't want to disappoint other people. So, I get that. It's a very admirable sort of rationale for not wanting to take on something else, because you don't want to have to let people down, right? The good thing about getting involved through your state medical societies, especially as a medical student or as a resident, is you can sort of dip your toe in the water and kind of see what people are doing, see what issues people are advocating on, and you can get involved more if you find that you have time or you have a passion for it, up to the point that you're, many state legislative societies have like internship programs or fellowships where you could spend a month in your residency. Instead of doing this like ICU rotation, you could spend a month in Washington, D.C., working in a congressperson's office, working on healthcare policy stuff, so that's like at the extreme end if you really want to plug in, or if you just want to like go to your local meetings and sort of advocate within the state or speak about issues or talk to patients. That's something you can do too, right? So it's customizable. It's like on a, as we say, it's on a sliding scale. So it's easy to sort of see how comfortable you are and see if it's what you want to do, right? And it may not be for you. I hope it is what you want to do, because I think there's a tremendous need for more medical voices in the legislature. But that's what I would suggest to people. And you don't have to do a lot of planning. You don't have to think too hard, because people love to have medical students and trainees plug in, because we need you. We need you to be involved. And that's what I would suggest. Dr. Goldstein, what do you think?
Yeah, I think those are all amazing suggestions. Actually, one of the first things I did was get involved with the HIV Medical Association of America. That I got involved with this group that helped me think about advocacy. And I think it's a great way to get your foot in the door. I think there are two things I'll say. One is there are tons and tons of doctors that are working in the political and policy space who aren't the elected official. And it's important to remember that you have a path forward in this space, whether you decide that you want to put your name on the ballot or not. And there are a lot of great opportunities for you out there. The second thing I'll say is that it's really, everyone who's a physician is smart. They can learn a lot of great things. They can take that knowledge and act upon that knowledge. It's about learning a new language. And the way that you learn the new language of politics is that you get involved. And I think Future Doctors in Politics is exactly that thing. It's a way that you can get involved, that you can learn the language, you can learn the skills, you can build a network of folks who are like-minded. And a group like this is a way to start your career in policy and take as much or as little as you need from it, right? If it's that you're going to get involved with the local chapter, great. And if it's that you're going to get involved with the national organization and push forward policy at the federal level, that's great too. It's just about learning those skills so that you can use them in your career.
Great. Thank you guys so much for this really energizing and inspiring discussion. This is just the first of many events, that we will be having in the future as an organization, and I could not have asked for a better way to start us off. So thank you guys just so much for sharing all your insights today.
to Senator Au. So that was a really fantastic conversation.
Yeah.
It was great to actually meet you. And I followed your career on Twitter, so it's great to have a chance to talk to you in person.
Glad we could bring you together. So as our evening's kind of coming to a close, I just wanted to take a really quick moment to share what all of you as medical students in the crowd can what you can do to bring discussions like these and other programs to your own campus. So, from the beginning, we have always envisioned that the target for future doctors in politics is all medical students, regardless of their different backgrounds, whatever your previous experiences with policy or politics. And so our vision is always to have chapters established at campuses all over the country. And, it happens to be that our founding chapter was established at Harvard Medical School this fall, where many of us are students currently. And, we've been actively recruiting from day one to get students from other schools to really join us in our efforts. And, we've been super lucky with the students we've already connected with so far, and we've already had a lot of interest as well. We have teams, starting at University of Hawaii, at Chicago, University of Michigan, plus many more from other schools that we've spoken to. We're joining new schools as part of our chapter accelerator team. And, all of our goal is to really collaboratively to co-create this model of what our chapters are going to look like. So we would love any of you, if you're interested at all in joining Future Doctors in Politics, to send us an email. So there's two ways you can go about this. So right now on the screen, there's our website that, the website's not on there, but if you go to our website, that's just futuredoctorsinpolitics.org, and you can fill out a chapter interest form there, or alternatively, you can just shoot us an email at the email that's shared on the screen, and we would love to start a conversation with any of you. We're really here to build a movement and a national network. So, anything that we're kind of creating at each of our individual chapters, we want it to really be imagined as something that is open to all the students in our community. And so kind of on that note, the first thing I wanted to share is that we're actually going to have our next event on March 3rd from 6 to 7 p.m. Eastern time. And it's going to be on the topic of legislative basics for the future physician advocate. So we can share more information on that. It's going to be led by Dr. Amanda Stewart and Dr. Avery LaChance. So we're really, really excited to have you all here. And now I'm just going to share a bit more before we close for the night.
Thanks so much, Mary. And thank you, Senator Au and Dr. Goldstein, for that rich and vibrant and very stimulating conversation that I think hopefully will move us all to find a way to get engaged in the future. Before we close, I just wanted to highlight from my perspective a couple things that Dr. Goldstein and Senator Au mentioned that I think really underscore the unique contributions doctors can make to the political arena. And that is fundamentally the why behind the organization. It's not just that we believe physicians have a professional responsibility to engage, it's that we believe physicians have something unique to contribute to this space that can really improve the lives of everyone involved. And so the first thing I think that was mentioned is that physicians are trained to be problem solvers. Dr. Goldstein spelled this out beautifully. We're trained to look at a problem, analyze the data, figure out the root cause, and treat it. And so if the evidence is there to suggest that the root causes of poor health among our patients is systemic, then we'll treat that with structural solutions and actual policies and not slogans and talking points. The second thing is communicating, also mentioned by both of you. One of the first lessons we learn in med school, and us first years are already learning this, is how to be an effective communicator. We're taught to meet patients where they are. We're taught to understand where they're coming from, to explain a complex idea in a way that they can actually understand, and then ultimately get their buy-in on a shared plan of action, which, as Dr. Goldstein mentioned, sounds a lot like campaigning, but also sounds a lot like governing. And then the last thing I'll say is that physicians are, from day one, taking an oath to be patient first. I love Dr. Goldstein's definition of the physician as being patient-centric, regardless of where you are or what you're doing, that the patient is at the forefront of your mind. And so I think for physicians, when we look at statistics like Black maternal mortality being 2 to 3 times higher than white maternal mortality, or life expectancy declining for the 4th year in a row, 27 million people in this country being uninsured, those aren't just statistics to doctors. Those are patients, those are people whose pain and suffering we have seen up close. And it's that story and that patient that is the driving force behind everything that we do. And so I'll just mention to everyone in the audience here that if that's the kind of outlook you want to see represented in the halls of government at every level, if that's the kind of person you want to see making decisions that will impact your health, I hope you'll consider investing in this cause. You know, changing the status quo does not happen overnight, and transforming systems takes time and resources, but it really starts with us getting organized. It starts with us planting the seeds now so we can build a future where an entire generation of physicians are pooling our resources and networks, converting that into political capital and really harnessing that to make our country's politics and policies work with patients in mind. So let's get organized. As Mary said, there's a couple ways you can get involved by reaching out to us to start a chapter at your medical school. You can also stay engaged by following us on social media. So we have our social media handles up here. We hope you will give us a follow or a like so you can track our progress. We'll also be launching a podcast designed to inspire med students, doctors, and others everywhere with stories like Dr. Goldstein's and like Dr. Senator Zhao's. And of course, we'd love for you to listen in. We'll share some more info about that on our social media accounts. And last but not least, please consider making a financial contribution to sustain our work. We're people powered, so every dollar counts. Just visit futuredoctorsinpolitics.org and click on the bright red donate button. No donation is too small. Your contribution, whatever it might be, will help us scale this work so we can ensure that our impact is sustainable and meaningful for the long term. I know the world of politics and policymaking can sometimes seem messy and complicated, and where do we even start? But it's people like us, people like all of us who are gathered here, getting involved that really starts to change that. And so I'd like to thank all of our board members and team members who've made the first step towards that path possible for us. And thank you all so much for being here. We hope this is just the beginning of a long and lasting partnership. And so as you leave, just a quick reminder to complete that post-event poll. We'd love to hear your thoughts, and thank you so much and good night.